All right, so we're going to look at another bone type of imaging, and this is what is known as the isotope bone scans. Isotope bone scans. All right, so that's what we got. So the isotope bone scan is also known as what? Bone scintigraphy. Okay, you can see that for the places that they want it for the image to be what? Enhanced. It's enhanced along. So they're actually nuclear medicines, they are imaging tests, they are usually used in orthopedics, and usually help you to look at places where bone activity is high. Okay, so the place that has been actually highlighted is not just for play, it's to see that there's high bone turnover at that place. So a small amount of radiographic isotope, that's a technetium 99M labeled phosphate compound, is usually injected into the vein. So the isotope is what is traveling through the bloodstream and accumulating in places that there's what? High bone activity, there's bone turnover. So a gamma camera will now dictate the radiations and will now be able to create the image of the skeletons, highlighting places of high bone turnovers. So it's used in orthopedics, can be used in dictating fractures, can be used in dictating all those bone infections, can be used in dictating bone tumors and what cancers that are kind of like spreading to the bone. So you can actually highlight it white or highlight it black. Do you understand? Highlight it darker. Also, avascular necrosis, where what the blood supply to a bone is kind of like cut up, can be used in what? Identifying all those arthritis and joint diseases and prosthesis what? Evaluation. Advantages is very sensitive. Okay, provides a whole body imaging in just one test. So it's useful for screening what? Metastatic disease too.